My name is Dr. Rabinowitz. I'm a board-certified plastic and reconstructive surgeon, as well as board-certified hand and microsurgeon. Pain in the wrist is oftentimes difficult to treat. Sometimes it requires injection therapy, but an area of expertise that I particularly have now are a broad category of denervation procedures. And with that, especially for people who have, say, wrist pain that has been unresponsive to non-operative measures, they've had multiple surgeries, and we see this very commonly where other doctors will send to me because they have ongoing pain and they can't cure it. And rather than have the patients be on narcotics the rest of their lives, which is really not a non-starter, what I can offer them is a fairly new procedure that's being done called wrist denervation. And with this, I'm able to target the specific nerves responsible for the pain in the wrist and actually ablate those, remove those, while still maintaining full function, full movement, full strength, but in the end, they have no pain, which is incredible. Nearly all reconstructive wrist surgical procedures are now same-day surgery. That's the wonderful thing that's evolved over the past 10 years or so. And also there are long-acting anesthetics we can inject into the wrist at the time of surgery to give them significant pain relief for the next 48 hours after surgery. So what they can expect is most of these procedures are done under anesthesia. They're asleep. And the procedures will typically be somewhere between 1.5 and 2 hours for most of them. And they typically will go home about an hour and a half after the surgical procedure. They will have a bandage on, they will have usually a splint on, and most of the time they're able to move their fingers, just not their wrist. Because of the long-acting anesthetic, there really is no pain for the first couple of days, and thereafter, usually only a minimal amount of pain medication is required. Outcomes for wrist surgery depends very specifically on the type of injury and the extent of the injury. Obviously, our goal is to restore motion and to restore strength, and we do that to the best of our abilities. Certain procedures may result in some limitation of movement, but usually it's not enough to impact what they do day to day. And in terms of recovery, depending upon the severity of the injury, the extent of the surgery, typically we're looking anywhere between just a couple of weeks recovery for arthroscopy to 2 to 3 months for the more invasive and complicated wrist reconstructive procedures. Reconstructive wrist surgery is right for the patient when we, meaning the patient myself, after discussion, realize that the injury that they have is a significant factor that impacts their lives, that it either impacts their ability to work or to do whatever activities they like to do in their free time. So that's a decision that I will make with the patient every time. And usually we try to start non-operatively, but if it comes down to surgery, that's something we'll discuss with the patient in terms of what we need to do and what they can expect post-operatively.